As the governor said, I'm sure you've all seen the coverage, excuse me, of young people at the beaches enjoying spring break. It's vital that our younger individuals take this illness seriously. You may not feel sick, but it's possible that you could transmit COVID-19 to someone who is more vulnerable. We are definitely all in this together, and we must take these steps together. As the governor said, today we're announcing 155 new cases for a total of 890 cases in the state. Sadly, today we are reporting 2 more deaths. One is a male in his 30s, from Essex County. The other is a male in his 50s from Bergen County. We have 11 deaths in our state. 9 of those individuals have had comorbid conditions. 2 are still under investigation. 7 are male, 4 are females. 4 are associated with a long-term care facility in our state. We're thinking of the families of each and every one of the individuals during this difficult time. Our thoughts and prayers are certainly with all of the families that are dealing with this. The county breakdown of the new cases are thus: Bergen, 48, Burlington, 2, Essex, 8, Hudson, 9, Hunterdon, 2, Mercer, 3, Middlesex, 11, Monmouth, 10, Morris, 4, Ocean, 15, Passaic, 12, Somerset, 4, Sussex, 1, and Union, 9. There are 17 cases we're still gathering more information on. And as I've said, we will see more cases in the coming weeks, a lot more cases. And as we see more cases, especially among nursing home residents and those with underlying medical conditions, the stresses on our healthcare system will build exponentially. I'm very concerned about that. And that's why we're continuing to explore unused space in hospitals and long-term care facilities, and to look at standing up new hospitals. I want to make it clear, we expect increases in cases. We expect a surge in cases that will stress the healthcare system significantly. This morning with the Army Corps, we did a walkthrough of a hospital in Woodbury in Spira, and I'm pleased to report that they have assessed that hospital to be up and ready right after we do a thorough cleaning and decontamination. The physical plant is in very good shape. So we do expect that that hospital will be ready to go and be on standby within 3 weeks, 3 to 4 weeks, 4 weeks the longest.
How many beds again?
300. We are also looking at a facility that used to be a hospital in Plainfield, New Jersey. It is now over 100,000 square feet of gutted interior, 48,000 square feet per floor. And the Corps will be looking at that tomorrow, and we expect that we can bring that up. That'll be fitted out, and we could bring that up in another 4 to 5 weeks. That will give us probably another 200 beds. So we'll have 500 beds of capacity, unused and ready to go when the surge occurs. Notice I didn't say if the surge occurs. We don't know exactly where the peak of that bell-shaped curve is, but we know it will happen. We're doing some predictive modeling right now to determine other areas in the state where we have to be prepared for critical care beds and additional medical, surgical, inpatient acute care capacity. We're also looking at closed wings at hospitals. There will be a complete review. We have about 7 or 8 that have come forth. And in addition to the closed wings, which we'll be able to bring up fairly quickly, we are looking at bolt-on wings that the Corps would build on the campuses of some existing hospitals. We're not only focusing on the Northeast, we are somewhat concerned of capacity in the southern part of the state. Even though the population is much smaller, we have fewer hospitals, and as a result, we need to be able to get capacity to handle any surge in the cities in the South. As you know, today, Bergen County Test Site opened. I want to give a shout out to the volunteers and primarily the healthcare workers, the nurses that came together and put that site up in very short notice. And it's not an easy task. Chris Neuwirth from Department of Health and the colonel did a yeoman's job, and it worked. People got tested, over 600 people got tested, and it will continue till there's no other people to test. And hopefully that will come sooner than later. Just a reminder, if you had mild symptoms, stay home and self-isolate. Separate yourself from other people in your home. Avoid sharing household items like dishes, utensils, and towels. And if your symptoms worsen, seek medical care, but call first. These steps can help protect you and your family from the spread of COVID-19. Thank you.
Judy, thank you for everything in your leadership. Two comments and a question. First, the question. The two fatalities from yesterday, did they have adjacent health issues? I know you said 9 of the 11. Does that include the 2 from yesterday?
Yeah, one did, and one is still unknown. One's under review. But
Thank
what
you.
we are finding is that most of the individuals, no matter the age, and I'm going to give a shout out for general health here. Diabetes is in almost every single individual. Hypertension, cardiovascular disease, obesity. So please, that's a shout out for taking care of yourself generally.
Yeah, I mean, this is the point I was going to make. It's 9 out of 11. You know, is it going to stay at that hit rate in terms of, God willing, the denominator doesn't go up a whole lot more? My fear is that it will go up for sure, but that's the point I was going to make. Just generally, there's an adjacency and an overwhelmingly high percentage of this. 2 quick comments. One is, if my math is right, one of the unknowns is now in Cumberland County, meaning Salem County is now the only of our 21 counties that doesn't have a confirmed case. And Judy is still working through 94 unknowns, so there's a chance one of them is from Salem. So that's just to give you a sense. While the numbers are the biggest by far, and Bergen and the north is more impacted right now than the south, we take the entirety of the state deadly seriously. And when you look at, in particular, as Judy mentioned, hospitals per capita, we're exposed more than we'd like in the south. My other comment is, I haven't had a chance to look at it, but I believe this is true, that this is a bunch of information if folks need to know where to text or know where to call. Am I right? So make sure folks commit this to memory, because these are the best places to go for information. Judy, I can't thank you enough to you and your team. I'm sure we'll hear from you during questions. It's now my honor to introduce the guy who runs this county. And again, this county right now has 249 confirmed cases, and that's almost certainly understating meaningfully the reality. I can't thank you. He's a dear friend. He's a terrific leader. Please help me welcome the County Executive, Jim Tedesco.
I sit here today to have to say my thoughts and prayers are to our 4th Bergen County family member that isn't with us today. And it's close to home for me. Governor, I can't thank you enough for coming here today to be with us. And I can't thank you enough for getting the FEMA test site here in Bergen County, where we are feeling the pain and the suffering of this deadly virus. Governor, I have a tool belt on and screwdrivers in my tool belt to screw down and making sure that people stay home. I'm here to be with you. I'm here to work with you. I'll give you all the screwdrivers you need to keep turning that screw down. I want to thank the New Jersey Department of Health. Commissioner Chris, your staff have been outstanding in helping us through this and even helping us get this site up and running. I can't thank you. I can't thank you enough. To the members of FEMA, thank you for being here. Thank you for putting boots on the ground to help us here where it's needed the most. To the Colonel, thank you so much. Thank you for the National Guard. Thank you for having your folks here helping us through. Truly appreciate it, Colonel. To the other Colonel, Superintendent of the New Jersey State Police. I've known Colonel Callahan for some time, and I can't thank him enough for having the support and the folks here to help us as we navigate through this. And I know that he'll be here with us throughout this entire process. To the EMS folks, and Governor, I hope you don't mind that mine's going to be more thank yous. I just hope the EMS folks, they've been stand up. Without them, we wouldn't be where